please.
Legislator Hathaway,
Here.
Legislator Berkler. Here. Legislator Burns,
Here.
Legislator Gilbert,
Yes.
Legislator Chartrand.
Here.
Legislator Moorhan.
Here.
Legislator Colzer's been excused. Legislator Osborne,
Here.
Legislator King,
Here.
and Legislator Dahlhoff.
Here. Everyone, please stand for the invocation. Legislator Gilbert, will lead us in that, please.
Our Heavenly Father, on this day of infamy in our nation's history, we express our deep gratitude for the sacrifices made by our forefathers. We ask now for protection over our community, especially our medical workers, as we continue to face the scourge of deadly disease and the consequences of isolation and uncertainty. Give us wisdom as we grapple with these issues. Finally, as we look toward Christmas, my prayer is that every heart would take encouragement from the hope represented by the miraculous incarnation and birth of Christ, in whose name I pray. Amen.
Amen. And the pledge. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The minutes of the November 18th, 2021 board meeting have been distributed. If there are no amendments or corrections, they stand approved. Reports of the Finance and Rules Committee per Rule 6, please.
Thank you, Mr. Chairman. The Finance and Rules Committee has met and they recommend to waive rules to act upon late resolutions.
Need a motion? Jerry, second by Rob. Discussion. All in favor? Aye. Anyone opposed? Motion carries. Privilege of the floor. Is there anyone here tonight that would like privilege of the floor to offer some comments? Moving on to presentations of petitions, communications, and notices.
Thank you, Mr. Chairman, but I don't have anything to report.
Reports of county officers and departments.
Thank you. Legislators received the November highway and solid waste audit reports as well as the treasurer's report. Brian Mooney submitted the November 2021 Sealer of Weights and Measures activity reports, which have been placed on file with the clerk of the board.
Thank
That
you.
concludes my report.
Reports of county officers and departments. I lose my place here. Reports of standing committees. Tom, would you start us off with finance and rules, please?
Thank you, Mr. Chairman. I have nothing at this time.
Any questions for Tom?
Hold on just a moment, please. Sorry.
Okay. I retract my statement. I've got, like 4 motions. A motion to authorize County Attorney Joan McNichol to refill 1 full-time secretary to the Assistant County Attorney position effective immediately due to a resignation. And make that a motion.
Moved by Tom, second by Dick. Discussion. All in favor?
Aye.
Anyone opposed?
Oh, I so wanted to say no. I welcome.
Jerry, did you name
Motion carries.
Now make a motion to authorize Information Technology Director Connor Belosi to send out an RFP for network switches and wireless access points.
Moved by Tom, second by Andrea. Any discussion? All in favor?
Aye.
Anyone opposed? Carries.
And I make a motion to authorize Information Technology Director Connor Belosi to refill 1 full-time computer systems assistant position effective immediately due to resignation.
Moved by Tom, second by Phil. Discussion. All in favor?
Aye.
Anyone opposed?
And the 4th motion, make a motion to move forward on the logo design by Rachel Gruner for rebranding Lewis County government.
Moved by Tom, second by Andrea. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
Then that's all I have, Mr. Chairman.
You sure?
Yeah, I was gonna say. Me too, and I was gonna say that.
Is he free to go?
Yes, that's it.
Okay, moving on to Jerry, General Services.
Thank you, Mr. Chairman. I have one motion. Motion to authorize Recreation, Forest, and Parks Director Jackie Mahoney to refill one full-time crew leader position effective immediately due to resignation. And I'll make that a motion, sir.
Moved by Jerry, second by Ron. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
And I have a few resolutions in the packet, and that's all I have, Mr. Chairman.
Thank you. Any questions for Jerry? If not, we'll move on to Andrea with Health and Human Services.
Thank you, Mr. Chairman. I have two motions. One motion is to authorize Social Services Commissioner Jennifer Jones to refill one full-time senior account clerk position effective immediately due to internal transfer. And I'll make that motion.
Moved by Andrea, second by Tom. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
I have another motion to authorize Social Services Commissioner Jennifer Jones to refill one full-time program examiner position effective immediately due to resignation. And I'll make that motion.
Moved by Andrea, second by Dick. Discussion. All in favor?
Aye.
Anyone opposed? Motion carries.
I also have a report from Ashley Wade from Public Health. We have 145 active cases. We had 256 active cases at our peak last January. We were at 180 active cases November 22nd. We did see a spike last week. We had 195 cases for the week. This is a weekly number we saw in January at the peak. Numbers so far this week are looking better. We only have 46 cases so far for Monday and Tuesday. Last week we had 51 cases on Monday. We have 6 residents hospitalized. We had 25 residents hospitalized at our peak last January. We were at 20 hospitalizations on November 18th. 73% of cases in November were unvaccinated. 77% of hospitalizations in November were unvaccinated. 68% of our adult population has at least one dose of the COVID vaccine. We have recently seen a slight increase in the number of individuals seeking first dose of the vaccine. We have 816 more adults to vaccinate to reach the 70% goal. 3,060 residents have received the booster dose. Our clinics are continuing to fill up. We have been traveling around the county to administer the booster dose. Our local pharmacies are also providing first, second, booster, and pediatric doses of the vaccine. We have gone all over local schools and vaccinated 121 children, 5 to 11 years old. We are going back this week, starting second dose clinics. We are doing a community-wide pediatric clinic Friday, December 17th at the Lava Fire Hall. We also have booster and first dose clinics coming up this Friday, the 10th, and next Thursday, the 16th, and next Friday. the 17th. And that's all I have. Thank you, Mr. Chairman.
Any questions for Andrea? If not, we'll move on to Dick as the board's rep on the hospital board of managers.
Okay, for those of you that have seen the paper, we did not make the closure list for elective surgeries at this time that the governor's put out. However, there's an awful lot of hospitals in our country that seems to have made that list. That's all I have at this time. I will answer questions on a couple of resolutions that they come up later on. I would like to point out that Mr. Kerr is here, and if you have questions, I'm sure he can entertain that as well. Okay, all set.
No questions for the information that Andrea passed along. We'll move on to reports of special committees. Cassie Buell, ad hoc committee for broadband expansion.
Connor's just gonna turn on the PowerPoint for me and be able to.
With the stagehand.
I'm gonna try to be close enough so that this thing works, So, as Ryan alluded to at the committee meeting, we wanted to provide all of the legislators with an update on the progress that our broadband task force has made over the last, 6 to 8 months. So some of the grant applications that we submitted this year, the Northern Border Regional Commission, also known as the Nbrc funding program, we submitted an application for $263,053 in May of this year. It was for fixed wireless and hotspot access points throughout the village of Copenhagen. The fixed wireless will be located on a tower that we use on the Hayes Road in the town of Denmark. So we were we identified that location first and foremost based upon the survey information that we gathered through the VATT program that we did with ECC Technologies. So we identified this as a underserved and unserved population for broadband access. And for the Community Development Block Grant, we had access to the CV funds, which is the coronavirus funds. And we submitted that application in July of 2021 in an amount of $747,000 for something similar, a fixed wireless and a hotspot program. The fixed wireless locations and hotspots that we were limited to had to be LMI eligible, meaning that it had to meet low moderate income eligibilities. So we were limited to the amount of areas that we could focus on for that. We did identify the town of Lionsdale, the village of Port Leyden, and census tract 9502, which happens to be in the town of Diana, right outside the village of Harrisville. So we were able to utilize the existing Lewis County owned 911 towers in those locations. And for Port Leyden, we set up because they did have access through fiber in the village, we were able to set up access points through that program. And fortunately, I can report that we've received both grants. So we've had very good luck this year applying for those programs. And I would attribute a lot of that to the survey information that we gathered from the ECC Technologies survey that we worked on late last year, early this year. So potential impact for the Nbrc grant, the Northern Border Regional Commission grant in the town of Denmark. You can see kind of the middle of I think this thing work. So the tower is located here, and you can see the potential impact actually spills over into Jefferson County. So they will definitely benefit from this project. And you can see it goes all the way down, essentially past the town of Lowville for the potential impact. And it's about 1,173 passes that we were able to calculate. We actually contracted with Hudson Valley Wireless to come up with this map. So, and we submitted this mapping with the application, and that also helped our chances. For the CDBG-CB potential impact, this is the Lionsdale Tower. We ran into a lot of obstacles here just because of the terrain, and it is very densely forested in this area, but we were able to impact a lot of the areas that have little to no internet service. So this is by putting on fixed wireless on the existing 911 towers. I believe it's Marmon Road is the tower location.
Yes.
It's near the Lionsdale site. And then the other tower we are able to put it on is the one up in Harrisville right off of Route 3. And that again also has a significant impact. I mean, most of the village is fiber, but then you get to all of these little crevices outside of Lake Bonaparte, and that's where they struggle a lot with. And then the town of Croghan struggles immensely just because of all their remote little niches right in here. We will have to eventually broaden out into doing a hybrid solution where it's fixed wireless and fiber to meet those areas, because we just can't meet those densely forested areas with a lot of the fixed wireless options. So for the CDBG funded access points, we received the funding to put in several access points in the village of Port Leyden. And access points are essentially free Wi-Fi service for the village. And it's really a community development, recreational push. You can see that we've focused on the recreational areas as well as the corridor leading down to the main street. We're hoping that that really helps businesses develop and improve and bring those tourists into these areas. And the third grant that we applied for, we submitted this application back in September. We had hoped to hear by now. They expected to make those award notices at the end of November, but unfortunately those are delayed. So the NTIA funding, it was a national program, $288 million available for federal assistance for broadband infrastructure to rural communities. So you might remember this resolution from several months ago, but the caveat is we had a partner with a provider of broadband service. So we chose to partner with Charter Communications because they were a fiber provider. And we really wanted to hone in on that direct fiber line rather than going into the fixed wireless component. Priority projects were given to applications that were willing to put forward at least 10% match, which we did. And the projects must be completed within 1 year of receipt, and that's certainly something that Charter said that they could do. So again, we submitted that grant application. The focus areas for this application were Croghan, Diana, Denmark, Blavel, Watson, and Constableville. And again, unfortunately, we were expecting to hear by the end of last month, but that we were just notified a couple weeks ago that that has been delayed because of the overwhelming abundance of applications, essentially. And the background work that they had to go back to each applicant, they've delayed that until early 2022. Which doesn't help us because we want to apply for more funding. We don't want to double dip in that funding.
How much did you apply for on that?
That was about 1.8 million for fiber. Fiber is much more expensive per household to install because you have to install on the roadway. So that one was much more expensive. And about 90 passings for that one. The village in Hamlet Wi-Fi access points that you have in front of you for a resolution this evening, we have we've worked with Charter Communications again on that application for NTIA funding, and something that came about during those discussions were the ability to provide bulk free internet access point services to our municipalities throughout our downtown districts. And Vermont has a lot of these where you enter a village and it pops up on your phone, you're now entering a free Wi-Fi zone, and it's a tourism community development component. So we've identified, with the help of the committee and a few legislators that I've reached out to in each of your districts, the best areas to propose these free Wi-Fi access points for community development. And you should have maps with the impacted areas. I believe we've gotten every single village in Hamlet covered with these access points. We are able to get a very discounted rate because we are going bulk, and obviously it promotes that economic and community development tourism factor. So we're hoping to really flex our ARPA funding because we are able to get so much grant funding. The funding that you guys have already agreed to put aside for broadband, that's what that $368,000 would come from. So some opportunities. USDA, the Reconnect program, they just release their NOFA, their Notice of Funding Availability, on November 24th. We have our kickoff meeting for the Nbrc grant and the CDBG grant on Thursday, so we hope to discuss this opportunity with the group that day. DANK was also awarded some funding to assist us with grant applications, broadband development projects. So there's a lot of funding coming in, so we're trying to keep up, but luckily we have all of the information in front of us to work with. So we're really optimistic that there's even more funding that we can get our hands on in the next 6 months. Problem is, there's many underserved locations that have received RDOF funding, which is federal funding. So with these areas identified as already in receipt of the funds, which we have no control over, we can't apply for federal or state funding for those areas. And for those areas that have received RDOF funding via Frontier Communications or HughesNet, they have up to 6 years to implement it. So can you imagine, like, the technology is then pretty much useless at that point, right? And if at all. So when we reached out to Frontier in the beginning of this process, they're like, well, maybe we'll end up doing that. And we're like, well, we can't apply for funding because you have the funding. So it just ties up the whole area. So that's with the NTIA. We only applied for 1.8 million. I say only, but we only applied for 1.8 million because we were limited to the areas that we could apply for because it was federal funds. So again, that limits our access to state and federal grant opportunities in those areas. And these locations are being evaluated. We can use local funds to try to get those locations served through either fixed wireless or through the fiber.
Can I comment on the RDOF?
Yes.
This is a big barrier for our community and for other rural areas because, like Cassie said, the state and feds are recognizing these areas as places that funds have been spent to be served, so they're not eligible. And to be very honest, our local telecom companies that have received this money have no plans within the next, they've got 6 years, so they're thinking, okay, we'll figure it out year 6 months through year 5. I mean, there's really no hope that they're moving on any of these. So that takes a lot of areas of our community that we could easily just start, moving and laying fiber on with some grant money. It puts all the cost on us if we're going to do it. And it's frustrating because if we spend, take our funds to give access to that area and then Frontier ends up, actually doing something in 2 years from now, then that's money that, could have been spent elsewhere. So, and all of the telecom companies are treating this RDOF plan as proprietary. So they have they don't have to tell us, Spectrum or Frontier or HughesNet, they don't have to tell us when they're going to be doing these projects. So that's a pretty big barrier, honestly.
So that has been a huge struggle of ours, trying to tiptoe around those barriers of what's been funded through the Reconnect programs in the past and the RDOF funding. But we are able to utilize existing 911 towers. Cheryl has been wonderful with getting us all the information that we need for that. Obviously, if we do find funding to utilize those towers with a fixed wireless program, we do have to go through the engineering to make sure that it's structurally sufficient for all of the new equipment, all that fun stuff that we just get to work on in the background. For the fixed wireless solutions, it's obviously a barrier with places like Lionsdale or Gregg that obviously have a need, but it's just not a good solution for those areas. Whereas Denmark, it's not as heavily forested in it. The signal can be, as you've seen, sent out 20 miles as opposed to 5 miles. So it's certainly something that's working against us there. So just to break it down for everybody, the current investments that we've had with the grant funds, the Nbrc, again, we applied for $263,000. We only have $65,000 that we are required to do as either a combination of cash or in-kind services. So a lot of our department services could be going towards that contribution. The CDBG, fortunately, is 0% contribution, so we like those grants, and we landed about $748,000 on that. And then what you have in front of you this evening is to move forward with the Village and Hamlet Wi-Fi. That's a 3-year contract that includes all of the installation costs, all the equipment costs, and the 3-year term. And the benefit of the Wi-Fi access point program is that the county can, when somebody signs on at a ball game or on an ATV trail or at a local a gathering like the fire hall, maybe they have a field days. When somebody signs on to use that internet, typically you have to enter your email address. Well, instead it's a managed Wi-Fi, and we can enter survey questions that maybe the county really wants feedback on. We can gather data on for tourism. We can do a lot of that because it is managed Wi-Fi, and we'll have control over that for 3 years. Now, if the municipality wants to take it over after 3 years, they're more than welcome to do it. A lot of the access points that we have are covering a lot of their municipal offices, so it would make a lot of sense if they just took over that. It's a cheaper rate. But they certainly don't need to do so. There's no harm, no foul if they don't want to do so. It's all paid for. So that's what that 3-year investment is. So all in all, we've landed over $1 million in grant funds, and right now we only have $65,760 committed. But after tonight, we hope that we're able to do more with the Wi-Fi. I was also asked to kind of squeak in a little plug for our Facade and Streetscape program. We had overwhelming response from this, which we were really fortunate to have. We had 34 applications in the round one. Of course, you made $250,000 available to local businesses and municipalities to spruce up their facades and streetscapes. We received 34 applications and it exceeded $587,000, which obviously we wish we could fund them all, but we were very limited. We awarded 17 grants in the amount of about $250,000, and 4 of those were municipal streetscape projects. So benches, permanent planters, dog poop stations, all that fun stuff. And 13 were existing and or new businesses. We saw a lot of investment that local entrepreneurs are taking into old buildings, which is great. It's infill. It was a great opportunity for them. So just wanted to go over the award winners for the first round. Robert Hazard, I don't know if you're aware of the Key Bank building in Krogan that's recently closed, and it's been vacant for upwards of a year maybe. They're doing some entryway improvements. National Abstract is doing a really great historical rehabilitation to their property. Krista Brown Photography in Lions Falls. Good Old Witchies is doing a complete refreshment to their facade. Tug Hill Artists and Roasters is, of course, doing wonderful things. They're going to tear out the porch, put in new windows, put in some shutter. They're going to make that jail look really great. It's going to be a great community feature. The Constableville Auction Hall, that was one of the favorited projects, right, Ryan? They're doing some new paint, new windows, refreshing that facade. Something that we got really excited about was the Prior Covey HVAC building right on the main drag in Port Leyden. He's looking to make that into a steakhouse, and the renovation proposal was really great. We're looking forward to seeing the outcome of that. Mark Lemieux, he purchased the Prior Port Leyden Elementary School, and they're doing facade work there. Bonaparte Pharmacy is repainting their pistachio green facade into something a little bit more palatable, right, Phil? Chuck's Market is doing a great project with their paint and some signage. Village of Copenhagen is doing is building off of their momentum that they've been doing on their streetscape. They're getting permanent planters and such. Town of Martinsburg is putting benches around their community. Tom Gillette is doing entryway improvements in the post office in Port Leyden on Main Street. Town of Diana Historical Museum is putting is freshening up their facade and fixing an awning that they have. The Village of Lions Falls and the Village of Port Leyden are also doing some streetscape projects. The Village of Lions Falls is doing the stairway, I believe, down to the basement area. And then Keith Young Knives and Engraving is in Harrisville is doing some facade work. So we had so many great applications, and it came down to, we had like 3 really great ones that we just did not want to turn away, but we didn't have the funding for. And after the awards were announced last week, we received 3 to 4 calls a day from businesses who are interested. They want to participate next year. What do we do? Who do we work with? Can we do it with the Historical Society? They were a great participant in this program, a great reminder of our historical downtown areas, and that we really want to preserve them. So I'm really looking forward to the next round. I'm really hoping we can work on that $200,000 because I think that it would be upwards of $1 million asking for the second round. So it seems to be a very popular and appreciated program from our businesses, and they've all said thank you, and they appreciate all of your investment and your time. So just wanted to give everybody a quick recap on that. Any questions? Yes.
Where are we at with we had another application, I think it was downtown revitalization.
Yes, we are hoping to hear that they're trickling in. Chinatown got $20 million, and they're in the Hudson Valley right now.
Okay.
So I'm waiting for Joe Beaver to call me.
So we're still in the running.
Yes, yep, no North Country application has been announced yet. Nope.
Thank you.
Anybody else? All right. Yep.
Oh, we forgot to turn Lisa around so they can see.
Oh, yeah, we forgot.
I use my medication.
Oh, okay.
Okay, so to move on, I have one topic I'd like to discuss. That is considering us declaring a state of emergency due to COVID and the pressure that's putting on our hospitals in the region. This is coming from our North Country Control Room, is what they call it. It consists of Lewis, Jefferson, St. Lawrence, Franklin, Essex, Hamilton, and Clinton County. So the majority of them, or all of them, were down to us. We have not agreed to do this. I wanted to discuss it tonight. But their recommendation is they would like to do a North Country state of emergency, and they would like Lewis County to be part of it. So that's discussion. Ryan, do you want to add anything to that?
I think you already covered it, Larry. Franklin and Clinton County never left states of emergency, so they've stayed straight through. St. Lawrence County had a similar conversation at their board meeting last night. They did declare a state of emergency. Jefferson County is planning, they have their meeting tonight, but likely they'll do the same. And Essex and Hamilton have indicated that they're willing to go along as well. So in reality, a state of emergency really only does two things for us. One, it makes us eligible for reimbursement of funds. And frankly, we've gotten quite a bit of COVID funds, so there's not a lot right now that we necessarily need reimbursement for. The second thing is it can give us special powers to curb behavior, stuff that traditionally the board has not been super interested in. So, really the most important factor is that it's kind of joining solidarity with the rest of the region, and also kind of giving people a bit of a wake-up call that, things are starting to escalate and get a little more serious.
Do you have thoughts on that, Jerry?
I would certainly endorse moving in that direction. From a health system perspective, for the better part of 3 weeks, Lewis County has had the highest positivity rate in New York State. It's something I report on daily, and I think in a recent communication I shared with the county manager, he forwarded that on as an example. We also have consistently had a very high rate for cases per 100,000. There was a period of several days in the last couple of weeks we were the worst in New York State on that number. Yesterday we were the 11th highest. Today we were the 10th highest. And that's an equalizer number when you compare less populated counties with more populated counties. And an interesting fact, this goes beyond the North Country, but I think it's relevant. On November 1st, the 7-day rolling average for New York State was 2.2%. And this morning it was 4.8%. And if you consider the total population of New York State and you consider over a 5-week period of time, that the 7-day rolling average has more than doubled, that's pretty profound. From a local perspective, local meaning the health system, the most recent changes to the religious exemption, meaning employees could not test out. We lost 5 nurses and 2 rad techs as a result of that. So every single day we are working hard to maintain appropriate staffing levels, limit diversion, so that we can continue to do elective surgeries. As you know, that's an important part of access to healthcare. And so for us, it's a real challenge every single shift, every single day. And a large part of it is essentially those who are unvaccinated, representing about 80% of the COVID inpatients that we have had over the last 2 months. And our experience at the hospital level, we are worse today than we were a year ago at this time with regards to number of COVID patients being served and in addition, having lost a number of staff as a result of the vaccine mandate. So I think it would be an important signal and help communicate that we are still in the middle of a pandemic. We're under a new wave, and it doesn't appear at this time that it's letting up. Thank you.
Ashley, you have anything you'd like to comment?
Our numbers are certainly higher right now than they were this time last year. We're heading into the holiday season where we saw our numbers take off. So history tells us that that may happen again. So I do think it's prudent to declare a state emergency.
Okay. Anyone have any questions? Dick?
Yeah, Larry, the state of emergency sounds like a good idea, but does that lock us into the 7, I think there's 6 or 7 counties that are in this North Country state of emergency? Does that lock us into any policy that they make? We have to support it too, or we still have the ability to make our own policy?
No, we would still be unique in that we would make our own county policy.
Okay.
As Ryan pointed out, this is more of an awareness effort. We don't really plan on any mandatory mask wearing or anything like that. We're continuing with recommendations: wear your mask, stay home when you're sick, maintain the 6 feet if you're indoors. The same things that we've been trying to reinforce throughout this whole period.
Okay, thank you.
So do we have any discussion on this?
I guess one thing I would just like to clarify with Jerry. You know, you hear different stuff. Certain people have got their shots and they still get it. And I'm talking for me and what I've seen so far, and if you could answer me back if I'm on the right direction. I mean, the bottom line, with you getting your shot, if you do catch it, somebody like me more than likely is gonna survive, where potentially if I don't have it, what happened on my viddies, I may not make it. And it seems even though people are coming back in that have had the shots and come down with it, the severity of the cases are nowhere compared to the ones that had not had the shot. Is that what we're seeing? And or am I wrong?
No, that's correct. The vaccine provides protection against getting COVID, and if you are a breakthrough case, you are less likely to be hospitalized. So you are correct. Ashley, you would concur?
I think those numbers that Andrea read before, we had, for November alone, 73% of our cases were unvaccinated. And then 77% of people going to the hospital with COVID were unvaccinated. So the majority of people, you know, having complications.
If you haven't been, you're like a moving target for it.
What's that?
If you haven't been vaccinated, you stand a heck of a chance of picking it up compared to somebody that has.
Yeah.
Yes.
especially right now.
75 to a quarter roughly. 3/4 to a quarter, people have been treated. Like me having a shot, I stand a 25% chance, and the ones that haven't look like it's a 75. Is that figure right or rough?
Well, those numbers don't exactly correlate to
Okay.
that, but yes, you are far less likely to be hospitalized having had the vaccine.
Okay,
And we have not, I will also note, we have not had any fully boosted individuals that have tested positive. So,
thank you for that information.
Is Lisa, do you wanna say something?
Yeah, so my whole family was exposed to somebody who had COVID, and my kid got it, and they tested positive. But it was a delayed, my husband and I didn't get it until the kid had it. So even though we were all exposed the same, it was delayed for us because we had the vaccine. And after taking care of my two kids who are too young for the vaccine, I myself, even though I'm fully boosted actually, I did test positive for COVID. I have very minimal symptoms, which I can't imagine taking care of two kids with fevers and the GI symptoms and everything they've been having while being sick myself. So, even though I'm very, unlucky that I, was vaccinated and had the booster, they still say about 10% could potentially get it, but, having very minimal symptoms, it's still worth it. And, after living in a house with 3 people who were COVID positive for 4 or 5 days is when I finally got it. So, I almost expected to get it at that point. But really it comes down to hospitalization. We have to keep our hospital doors open. And one of the best tools to do that is to not clog up the beds with COVID admissions. And so if that's all this vaccine does, it prevents hospitalizations and deaths, then it's worth it. It's one of our best tools.
Thank you, Lisa. And I hope you do well.
Larry, can I ask you actually one more question?
Sure.
Ashley, we hear the breakthroughs with people that have been vaccinated get COVID. But are there any records out there of the people who had COVID and get it again?
yes, I mean, we track reinfections as well. I don't have those numbers for you.
But you could get them in a couple of days and give us an idea what they are or not.
Yeah.
Well,
Give me a week.
yeah, that's fine too. What I hear out there a lot of times is, I've had COVID, so now I'm immune and I don't get it again. And I haven't heard anything about, other than the breakthrough with the vaccinated people, about how that goes. And, I'd be interested to, and it might help a little bit with some of the people in there.
We don't have a lot of reinfection, but I will get you more numbers.
Okay, thank you.
2 days.
Actually, having worked for you this weekend, would you say many people that have had COVID are just not getting tested when they get sick again? Is what I experienced doing calls this weekend. Is that people have been sick and they're sick again, but they don't want to be tested. They're just not going to get tested.
Yeah, there's certainly a population, not getting tested or doing home tests because they're widely available now and not necessarily calling or reporting to us.
So then she doesn't have the data.
If they're doing the right thing, then that's fine by me.
One of the biggest things that we've been talking about amongst our team over the last couple of weeks has been, a message shift, really hammering, if you're sick, stay home. So we know there's people that are, tired of the pandemic and they don't want to think about COVID anymore. And so they're not going to get tested. They're not going to be engaged with public health. And, to a certain extent, that's their decision. But at the very, very least, the least you can do for your community is if you're sick, stay home. You know, you don't have to get tested, you don't have to, you know, you're just not gonna go through public health and all, we encourage you to do that, but if you're not going to, then the least you can do for your community is stay home.
Just to touch on that, for our positivity rates, being between like 10 and 20%, I think that if you are an unvaccinated individual, you have to assume that you have been in contact. Well, everyone needs to assume that you've probably been in contact with a COVID positive person. You know, if 1 in 5 or 1 in 10 people in Lewis County has COVID, you have to assume that you've been in contact with somebody who's COVID positive. So if you are unvaccinated, you should act accordingly. And that is monitoring your symptoms and testing if you have symptoms, wearing a mask, and staying home.
So would someone like to offer a motion to enter a state of emergency? Jerry, second by Tom. We can continue the discussion if anyone has thoughts. All in favor?
Aye.
Anyone opposed? Motion carries. With that, we'll move on to the county manager report. Ryan, please.
Thank you, Mr. Chairman. Quickly, you may have saw yesterday, we had to make a press announcement that some of our services at DSS were going to be remote because we had a heating issue on Stowe Street. I want to give a shout out to the staff that works down on Stowe Street. You know, those are services that we can't just close for the day. And so it was at its low point around 55 degrees before we got it back up and running last night. And our employees are real troopers. You know, many of them went home, got some warmer clothes on, came back to work. Matt scrunched up about every space heater in Loudville, and we were able to stay open for the public, which we need to do. So I went over there yesterday afternoon and was very impressed with our employees. You know, some of them were in blankets, some of them had their coat on, and they were still there working away. And just, you know, an amazing, resilient bunch that we have that work for us. So thank you to them, and thank you to Matt's team that had to make a trip to Rochester yesterday afternoon to get the part that we needed to turn the heat back on.
So it's on now?
It is on as of last night, and how was it in there today, Jenny? Nice?
Nice and warm.
Okay. So we're back up and running. But, you know, a timely reminder that this project that we're doing is, you know, not a day too soon. You know, we're starting to have real failures in the infrastructure up there. And so it's good that we're moving forward with that. We received 2 proposals for the Ag Sustainability Committee. We're going to do that dairy enhancement study that was approved by the board several months ago, but we're finally moving forward with those RFPs. The Dairy Sustainability Committee met today and went over the RFPs, and we will have a recommendation for the board for the 23rd meeting. We will engage with one of those consultants and move that along. We have been doing the Ag Sustainability Committee for 3 or 4 years at this point, and I think a lot of good has come out of it. I will say, though, that John Lehman started on the committee, and then Greg Calzer continued. So going into next year, if there's any volunteers from the board that want to get involved with that, we'll have opportunity there because we seem to replace legislators that are on that committee. So Fort Drum Social is the holiday social is Sunday at 4 o'clock. Dick and I will be attending, but really, if any legislator that is interested in that, it's a very nice event. If you let us know, we can get you cleared at the gate, and you can go over with Dick and I. New legislator orientation for our 2 new folks that will be joining us on January 1st. The new legislator orientation will be on the 22nd. And Lisa and Ian, I don't know if we were able to do a tour of the jail with you guys. Ian got a tour of the jail. I don't think Lisa did. So I'm trying to organize a tour that day. So anyone who has not been through the jail facility, let me know. You know, every time we have new legislators, an opportunity for folks to do a tour again of any of our facilities. So if you're interested, just let me know. Another thing that we're planning that will be new in 2022 is a department head retreat. We're going up for one day to Oswegatchie up in the town of Croghan. And we're going to be talking about kind of what we hope to achieve over the next 2 years. Make sure everybody's on the same page. This will be in late January. We're zeroing in on the date. But any legislator that would like to participate is more than welcome to participate. More than welcome to join us for a day. We will have a facilitator. We'll do some group like team, team bonding, team challenges, team building activities, as well as some facilitated discussions on kind of where we want to go over the next couple of years. So more details will be coming on that. And other than that, I can take any questions.
Ryan, just to add to the Fort Drum on Sunday, if you haven't been to it, I worked down there, so I got to go to it quite a few years ago. They really and truly do appreciate the legislators that go to it. And it gives you a chance to meet some people in the Tri-County area that you normally wouldn't meet or interface with. And it's just, they decorate the Laurie Mansion for Christmas season. It's just fantastic how they do it. I'd strongly suggest some year, not this year, taking advantage.
Randy Lachos always used to go. He used to love going. They have amazing food too.
Any questions, other questions for Eric, or Brian, I mean, sorry? We won't have a county treasurer tomorrow report tonight because Eric isn't here. So we'll move on to the Finance and Rules Committee for Rule 7, please.
Thank you, Mr. Chairman. The Finance and Rules Committee reports that they have examined the claims presented for payment in the total amount of $1,594,302.80 and recommend that they be audited and allowed for the amounts claimed.
Any motion? Ron, second by Andrea. Any discussion? All in favor?
Aye.
Anyone opposed? That carries. So resolutions. We have some that need to be.
Yes, we are gonna pull out of the slate, resolution number 298, resolution number 312, resolution 317, and resolution 318.
Anyone have any additional resolutions they'd like to vote on separately? If not, the motion to pass the remainder is this way. Tom, second by Ron. Any discussion? All in favor?
Aye.
Anyone opposed? Slate carries. So we're back to 290.
Yep, resolution number 298, auditing and allowing claims in the amount of $1,594,302.80.
Moved by Jerry, second by Ian. Any discussion? This is a roll call.
Legislator Hathaway,
Yes.
Legislator Burns,
Yes.
Legislator Chartrand,
Yes.
Legislator Calder's been excused, Legislator Osborne,
Yes.
Legislator Verkler,
Yeah,
Legislator Gilbert,
Yes.
Legislator Moorhan,
Yes.
Legislator King,
Yes.
and Legislator Dahlhoff.
Yes.
Resolution number 312, resolution authorizing agreement between the County of Lewis and Park Strategies to provide professional government relations advocacy, representation, and strategies on behalf of Lewis County before New York State government.
Moved by Dick, second by Jerry. Discussion. I just had a couple of quick questions. I have no problem with it. I just wanted to understand it a little bit better. The resolution said that something to the effect that they could advocate for medical or other. What would be an example of medical and other?
So, for example, the hospital has been waiting quite some time for their certificate of need from the Department of Health. That's something that, once we have a contract with these guys, they can maybe help usher us through that process. There's lots of interaction that our agencies have, including the hospital, with state oversight agencies, helping move things along or understanding, where holdups are, is part of this as well. Basically, anything that the county is interested in investigating or getting more advocacy or more involved in state government, they will help us.
As we add these things, does it add to the cost?
Nope, it's a flat fee. Think of it like a retainer, basically. We get their services all year for that cost.
And are there measurables with that? I mean, just as it happens, we can see whether it's working or not. Is that the idea?
Yeah, I think the thought is that we've kind of said for years that, Albany doesn't share our vision when it comes to ATVs.
Right.
There's a lot of things Albany doesn't share our vision with.
Right.
But when it comes to ATVs particularly, we just kind of have this idea that, there's some environmental groups that don't like it. And there's, certain people in the transportation committee that don't like it. Let's meet with those folks. Let's have someone help us get down to the nitty gritty. And maybe we can't get everything that we want, but maybe over the next year, we can at least understand kind of what some of the holdups are, and maybe we can move the needle and search for some compromises. Maybe there's some things that would help us that, they wouldn't find so offensive. So I think for me anyway, it's really just about exploring and learning about what we don't know, and maybe we can move the needle on this issue. And if anything else comes up, we can ask them for help there as well.
Thanks. Any other questions? All in favor?
Aye.
Anyone opposed? Motion carries.
Resolution number 317, resolution authorizing modification and extension agreement between Lewis County and Miller Engineers and with New York State Department of State for additional professional scope of services under the grant awarded for the Central Lewis County Regional Water Project.
Moved by Ron, second by Jerry. Discussion. Dick, you got it?
There was a couple of things that I wasn't sure of, but we had the initial report from these folks. And my understanding, we were gonna meet with the 4 entities that were in the study plus the village allowable. I got an email here a while back that mining had actually met with one of the groups. But I think it would be better if we had the 4 groups plus the village all in meeting, and I was just hoping that we could agree on that and set that up for the near future after the first of the year.
Can I ask one question? I mean, I thought we started this and people that want to participate have participated, and this is the funding they received, and we've had a little bit of money left over. Are we still trying to drag people in that weren't there the first time? It sounds like it.
No, we're trying to explain to the people that were there the first time what actually happened, Jerry.
Okay.
Because these towns meet and talk back and forth, and they, it's not a straight path where everybody gets the same input at the same time. I think communication is that we should talk about.
So, both questions. Yes, the new agreement specifically has a certain number of meetings, and Cassie Buell and I have specifically told Miller that one of the things we want out of this next contract is a group meeting with everybody where we can kind of go over where we've been and kind of outline some of the steps that we'd like to take going forward. This next phase will still not include any particular study with the Village of Loudoun because they didn't want to participate. However, you can't really generate any realistic, viable solutions to countywide water without talking about, or at least talking to, the village of Lowville, which, controls, has access to a large watershed. So I think both. We're not necessarily doing any studying on their behalf, but we do need to include them in the conversation because without them, a true regional solution doesn't make sense. So.
Thank you. Thank you.
Anything else? All in favor?
Aye.
Anyone opposed? Carried.
Resolution number 318, resolution awarding bid and authorizing agreement between the County of Lewis and Roscoe International for the purchase of bus stop shelters.
Moved by Jerry, second by Andrea. Discussion.
Larry, I asked for this one as well. There was an issue in this conversation a while back on maintenance of these once they were put in place. And is it my understanding that that has since been solved and somebody other than the village will maintain them?
Has agreed to maintain the one in the Lowville Commons area. And if we were to, the only issue on any of the bus stop shelters is in the village of Lowville, the shelter that we want to put next to Dollar General. That's the only one where we're questioning who's gonna maintain that, but it's not gonna be installed unless that is agreed upon ahead of time. That's something that we're working out internally, is who's gonna handle the maintenance of that shelter, which I say maintenance is checking it to make sure there's no cracks in the plexiglass and occasionally taking out a 10-gallon trash receptacle.
Is Matt involved in that so that some of his people, if they had to do some of that maintenance work?
It's my understanding that Robert had reached out to Matt a couple months ago. But again, that's not something we wanted to really cross until, and it was only that one shelter, it was nothing on the TLS. But,
Okay, thank you.
yes. Yep.
Any other questions, comments?
I would just like to say the courthouse looks very nice, and is that Matt's department that decorates? Thank you, Matt. Looks super nice. When you drive through town at night, and the church is beautiful because they have stained glass is all lit up. It's really, really nice. Thank you.
Thank you. All in favor?
Aye.
Anyone opposed? Motion carries. That is the end of the resolutions, I believe. So we're going to move on to other business.
I had some other business, if I could.
Sure, Michelle.
Gary King, now I don't mean to be negative,
Okay, fire away.
but I know you remember, because you haven't forgot anything since you've been 6 months old.
Yeah, thanks.
Back in 2009, my first meeting, you and I had a very spirited discussion regarding a county facility. And you don't remember it? Okay. And here I just praised you for your memory.
No, you bring it up, I probably will.
Well, it might have had something to do with solid waste department
Okay,
in Krogan.
okay.
But anyway, after that spirited discussion, and after a few more of them, I started a spreadsheet. And I've kept a spreadsheet all these years. And I gotta tell you, it was close, but the results are in. And by a small margin, but you won. You are more bullheaded than me. I had the data to prove it.
Well, I thank you very much for that. I'll take it as a compliment. And, we've all had good spirited things. And I think that's helped us make good decisions in the long run. And I've enjoyed working with everybody here.
Well, I'm not done.
Might go the other way now, right?
I gotta tell you, you're tenacious. You even got me to be pushing for the capital projects now, this time around, as opposed to when it was before. You wore me right down to a nub on it, Jerry, but I came around eventually. But I was wondering, is it true that you're researching the criteria so you'd be ready to answer the call when the sheriff asked you to be an SRO?
Maybe.
I know,
It would be better if I didn't answer.
I know you are so in favor of that program. I figured you probably wanted to be involved, and because you and the sheriff have bonded so well, you know, on this issue.
Where are you going with this, Bill?
Well, he's in favor of the SRO, it's the RSO.
Right, there you go. That's right.
Can't quite buy into that one.
It's a balancing act, you know, what can we accomplish and how can we accomplish it without it costing us a fortune? I look for some of that stuff.
You know, Jerry, the only other thing that some of the people that weren't around when I first got on the board, I just wanted to mention, I had black hair until I got a hold of you. You didn't have any hair.
Oh, come on, I haven't
Even
done
then,
this.
but my hair was black, and look at it now, after dealing with you all these years, Jerry.
Oh,
Well, it's been real, Jerry, I gotta tell you.
I thank you, and it's been a pleasure working with you. We've challenged each other, I mean, to extremes at times. Charlie was in there and quite a few others. And, I mean, every legislator I've worked with, not on purpose. I think they can say some of the same stuff. I do believe in it. I fight for it, and it used to be hard to let go if you didn't win, but you move on to the next thing now, you know. But we got some good stuff done for the members of Lewis County, residents of Lewis County. And it took every legislator that's been here to make it happen. The ones previously and stuff like that. And some of our good knockdown drag-outs and this and that. But, you know, I've always had, even after discussions, respect for whichever views people have had.
See, Jerry, this is the thing, you've turned my roast into a nice soothing conversation.
That comes with age. Don't poke the bear. I learned that a while back. No,
And that would conclude my part of new business, other business.
I thank you for that. I appreciate it.
I didn't mean to be negative.
We've got some other,
Some of it was probably somewhat the truth, though, Phil.
we've got some other Jerryisms that we collected and we wanted to share as well. So, I don't mean to be negative on the same aspect. RSO, I'm not giving you a hard time. But my fellow legislator, you always say that. I don't mean to be negative, we talked about that. And my favorite one, he doesn't have a pot to piss in or a window to throw it out of.
Yeah, but that's usually in your office.
What about right, wrong, or indifferent? I feel like that's the one I
Go on.
Right, wrong, or indifferent.
Yep.
Yeah.
Consider violence.
6 of one, half dozen the other.
Oh, yeah, that's another
I think Jerry is also famous for always wanting to have a discussion, always wanting hear from his fellow legislators. I'm not sure it ever really changes position on the discussion, but he always wanted to hear from everyone else. And if you didn't agree with him in the initial discussion, there would be a second and maybe a third or fourth discussion on the phone, which each, would last maybe an hour or so each time. But
Wear them down.
So I can add one too, that very often after a board meeting the next morning, I would receive a call from Jerry, usually at 8:25. First of all, to make sure I was in the office, I'm sure.
There was some mornings you weren't.
Yeah. And to go over what happened the night before and what we had to do to follow up on some things. So I would always know to make sure to get in early on most mornings after the board meeting.
And if you weren't there, I'd call back.
Or you call Ryan.
I'll catch somebody.
That's it. You have anything else while you have Jerry in the chair?
I deserve it all.
If not, we need a motion to enter attorney-client privilege session, litigation matters. We have a motion to go into executive session. Dick, second by Tom. All in favor?
Aye.
We're going into executive session. Do we need a 5-minute break or anything before we do that?
Good.
Oh.
Sounds good.